mics don't exist. Do talk into them, but like we're just having a conversation. Hey.
Welcome to the About Sex podcast. I'm Joshua Skirtu, and with me, as always, is the star of our show, Angela Skirtu. Hi, Angela.
Hi, Josh.
Tell them who you are.
I'm a licensed marriage therapist and ASEX certified sex therapist.
Awesome. And with us today is Brooke Kalesiak of
Legacy Physical Therapy.
Your board certified women's health physical therapist with a passion for treating pelvic issues such as pelvic pain, bladder leakage, painful intercourse, and bowel dysfunction. That's a big paragraph. I'm not going to read that whole thing.
She'll go more.
Okay, so let's get into it. You treat pelvic floor. You're a pelvic floor specialist. So what is that?
There you go.
Yeah, tell us a little more about what that's like.
Thanks for having me in that. So pelvic floor physical therapy is a subset of physical therapy that specializes in the pelvic area of the body. So hence I brought my pelvis today, so we have visuals.
She has an actual pelvis.
I have an actual pelvis.
Pelvic bone and everything.
Angela's going to show the actual pelvis.
There's the back.
Oh, wow.
Because everybody likes a badonkadonk.
Oh, yeah.
The backside.
Bring that tailbone
I
out.
usually like to call it when I show it to my patients. I'm like, here's the gynecologist view that they get, and that's so that we can talk through where the muscles are.
That's
and
fun.
that so
We'll take a close-up picture and post that on.
there we go.
For the audio
pelvis
podcast.
Love.
Yeah. Okay.
Awesome.
Well, so it's not just the vagina; it's like other areas in the pelvis too, like the hips, or
Correct.
Okay.
So pelvic physical therapy can encompass anything from pain in the hips, pain in the low back, SI joint pain. It can deal with rectal pain or vaginal pain. Sometimes it's all on the outside. It can be vulvar pain or vestibular pain, which on the outside area. And there's many different causes to it. As a physical therapist, my area of expertise is what are the potential musculoskeletal causes. And so as part of the treatment team that works with pain and dysfunction in this area, my job is to figure out what is potentially going on musculoskeletal-wise and help the patient work through those aspects of it.
So what are some of the reasons women have pelvic pain, or men? Because I think don't you work?
What do people come in for? Like,
So good clarification. We both men and women have pelvises. And
Yeah,
that
I
is
think
true.
that's true.
One,
Allegedly. Allegedly, I have a pelvis. It has not been confirmed.
Well, we didn't call him Elvis the pelvis for nothing.
And actually the pelvic floor muscles on the bottom side of the pelvis in males and females are very, very similar. And that's so males and females can have a lot of the same issues. Females, pelvic floor issues and pelvic pain issues do tend to fall predominantly in the female population, but males can definitely get pelvic floor pain. I work with a lot of guys who are dealing with issues after prostate cancer or dealing with incontinence or erectile dysfunction issues then. But the most common things I see at my clinic are women dealing with pain with intercourse, pelvic pain in general. I have a lot of women who just the act of they couldn't sit here and talk right now. Like it would be too uncomfortable to be sitting.
Painful
and
to be
then,
sitting.
It's just painful to be sitting.
Well, what do they do if it's if it's too painful to sit? I mean, are they like just standing all the time?
It sucks.
So
lots of pillows.
Lots of pillows, lots
Yeah.
of different support cushions. A lot of people, end up getting a standing work desk and really alternate between standing and laying down and avoiding sitting as much as they can. And so, in extreme situations, I haven't had a patient like this, but I've heard of patients who, have to get like a big recliner type situation that keeps them completely unweighted, and that when they're dealing with severe forms of that pain.
Oh, yeah.
Oh, wow.
So
Like zero gravity
The zero
chair.
gravity
zero
chair.
gravity
You have one
chair.
of those, actually. Yeah.
Oh, yeah. It's the most comfortable chair in the world.
Yeah, because it just kind of puts you in a weird position.
If my
but
back's
like,
hurting,
I
I
love
lay
it
on
too.
that thing. It's
Yep.
perfect.
Yep. No, so it takes lots of
I'd
pressure
like
off.
to be like displaying this while you talk,
There.
just for fun. Hello,
pelvis
there's a
has
pelvis. Woo!
Can make
Continue.
it float like
I know. Oh, like hovering,
yeah,
right?
the hovering floating
That'll
pelvis.
The pelvis. Oh, that'd be cool if we put like a little ring behind it so that it was like an angel
Yeah, I'm
pelvis.
not going to do that. That's beyond my capability.
I can't do that.
I'm not doing it. Not doing it.
Not going to happen.
Okay, well, so anyhow, like, so how do people find out about you? Because to my knowledge, a lot of people don't know that this sort of pelvic floor treatment exists. They've heard of physical therapy, but they're like, vagina physical therapy?
Yeah.
What?
Yes, yes. I get a lot. I'd say 9 out of 10 people that walk into my office said, my doctor told me to come here, and I have no idea what you were going to be doing. I've gone to physical therapy for my knee or for my ankle,
Right.
and
That's funny.
they're like, I have no idea how you're going to do physical therapy for my vagina. So you are exactly correct that most people do not know about pelvic physical therapy. It has been around as a subspecialty. So there's the American Physical Therapy Association, and underneath it is the section on women's health. And that has been around for over 25 years.
Okay.
It started out as a group that wanted to focus more on pregnancy type stuff, and it slowly evolved over time to encompass kind of all things related to pelvic and women's health. We're kind of going through a name change type time in the section of women's health, because we realize that we leave out half the population by calling it the section on women's health.
I know.
And we deal a lot with
What about
We
you?
also have
pelvic
pelvises.
issues. Yes, males also have pelvises. So,
Apparently.
so they're trying to
New
figure out.
news.
Yes.
Men have pelvises
This just
too.
in.
So in general, most people don't know about it,
No.
and they usually get a referral from their physician. So their OBGYN, gynecologist, urogynecologist, urologist, those are all common people that we see referrals from. We often get referrals from sex therapists and family therapists
like
and
Angela.
co-treat that way,
Yeah.
or with doulas and midwives, and that we work a lot with them and talking with them and helping their patients out. But frankly, more people need to know that pelvic physical therapy is out there. And that's so one of the things that we're trying to get people more aware of is, so in France, every woman who's had a baby automatically gets a referral to pelvic physical therapy.
Really?
For
Make sure everything's okay.
to make
yeah?
sure everything's
Yeah.
okay afterwards and that. And so that definitely does not happen here in the United States.
Oh, no, not at all.
France is very forward thinking. I think they even send a person home with them to help watch
Oh,
their
yeah.
baby during the beginning times. I'm
Yeah.
like, wow, yay, France.
Yeah. It's like,
I mean, you need it. Come
You
on.
Yeah.
do. It
It's
takes a lot
exhausting.
of people to raise a kid, man.
I know.
yeah.
I do remember.
It's like, I remember there were
we have
three
a
of us
2-year-old.
Like, wait
in
a
this
minute.
house, and we all felt busy.
She didn't sleep
Oh, yeah.
through the night till she was 18 months old.
Oh, yeah, that's rough. That's really rough.
Our baby is very energetic. She still is.
Well, to be fair on what you were saying earlier, I mean, so like people will come to me. I'm obviously a sex therapist, and it's funny to me how rarely, like the whole pain during intercourse thing kind of comes up in passing. Like it's more they're there because, oh, we're not having sex, and oh, and he's mad, of course, or annoyed because he's
Right.
like, you never want to have sex, you never initiate, which that's another desire issue we might
Right.
not cover today. But like, then somewhere along the line, she'll tell me, well, it's kind of painful. And then I'm like, wait, how long has it been painful? Is it painful every time? 0 to 10. How far is this going? And like, she'll be like, very painful. And it's been there for several
Really?
months. And I'm like,
Wow.
you don't have to do that. That's why, like, people avoid pain. Like, that's just
like,
kind
we're
of a
gonna avoid
natural
it.
tendency. And so then, of course, I'm like, did you know there's physical therapy? And you
Nobody
can do
knows
something?
that.
Nobody
No.
knows.
Nobody knows
They
that.
never know. And they're like, wait, what's that? And they're
So,
always freaked out.
If you have pain anywhere, talk to your doctor. I mean, maybe there's a physical therapy for everything.
That's
you
true.
never know.
But not all the doctors know about physical
Correct.
therapy
And that,
About
for
pelvic floor.
for pelvic floor.
correct.
I didn't know about it till
Yeah.
I met her.
Yeah.
Really?
Yeah.
Right?
Yeah. Till you
Yeah.
introduced.
I
Yeah.
didn't know about it until I became a sex therapist.
Yes,
There you go.
exactly.
Yeah. No, so there, unfortunately, in medical school, there's very little training
Yeah.
that the OBGYNs and gynecologists get in regards to what the pelvic floor muscles do, so specifically the musculoskeletal side of it. And then they may get in passing, like, hey, there's pelvic physical therapy. And
Yeah.
in their 4 years of schooling and that.
They get
so-
one
a million
sentence.
things
Yeah.
they have to
and they're
remember.
learning everything else they need to know.
Definitely not on the quiz.
And that's,
No.
and that's so when I actually get to go and talk with the OBGYNs and neurologists and that, like some of them, they just really have no clue that it's anything out there. Or I've actually been insulted by a physician who had said, well, don't you just teach people Kegels. Like, I can just tell them what to do. Like, that's
Yeah.
fine.
No.
That it's only about Kegel exercises.
So what do you teach them?
Oh yeah, well we should
Like,
learn about
what are
that.
some of the treatments?
How are you
for-
different than Kegels?
Yeah. So
So what's a Kegel first?
Yeah, for
Yeah,
those of
right.
you who don't know, a Kegel exercise is simply a contraction of the pelvic floor muscles. So what that means, or cues that I give people for that, are pucker your anus like you're trying to hold a fart in.
Got it.
Works.
Check.
That'll be a fun new one to
Yeah, there you
use.
go. Or try to stop the flow of urine. So hold in there. Or you can think about sucking your vagina straw up. For guys, you can think about like you're walking into a bunch of cold water and you don't want the boys to hit the water. So you're trying to pull it up a little
Retraction.
bit. Retract.
I always mess with them and say, you know how like sometimes you have an erection and you move it back and forth? Whatever muscle you're using to do that, that's the muscle
There you go.
system.
Oh,
There you
They
go.
love it because they all try to move it and do
like-
tricks
Oh
with it.
yeah. Try to make it bounce.
Kind of a guy thing. They
There
love
you
their
go.
penises.
There
But anyhow.
We're big fans.
So, a long time ago, a gentleman named Kegel coined the phrase that he figured out that if people or women exercise those muscles, that it can help with urinary incontinence, other urgency, frequency, bowel issues, all that kind of stuff. And so ever since that, I don't know exactly when, I think it was back in the 50s or 60s, now, they've been referred to as Kegel exercises. I usually call them pelvic floor muscle contractions because I don't want to give credit just to that dude. And
one
often-
guy.
One guy gets
One guy.
credit for it all. But also
One guy
because-
tells you to clench, and that's it.
Well, one
So-
guy's the one for the Grafenberg spot,
Yeah,
too.
there you
So I was
go.
like, well, you know, whatever.
So pretty much most of
always
the
men,
female
isn't it?
anatomy is named after men.
Yes, yes. It's like,
Because
wait a
all the
minute.
I
men
founded the vagina.
all the OBGYNs were men back in the
Well,
day.
yeah, that
back
makes
in the day.
sense.
Yeah, so yeah, we all got male name issues. So
Yeah.
like, wait a minute.
Well, then maybe there is penis envy going on.
There
You
you
never
go.
know. No,
There you
just
go.
joking. That's not a real thing. Go.
But pelvic floor muscles, so the Kegel is just a contraction of them. And so a lot of times I don't even tell people that they're doing Kegel exercises because research has shown that 40 to 50% of women are doing that contraction wrong. And
Yeah.
so they
Oh,
think
okay.
they're doing the right thing, but they might just be clenching their butt cheeks or using their inner thighs, or they're actually pushing out when they should be pulling in. And that's so,
Oh, there's a difference.
yes,
Yes.
there is a difference in that.
Yes,
So
you can push out pee or you can hold pee in.
No,
Yes.
I can't.
You can-
You assume I have control over that.
I
at all.
know those
Yeah, there you go.
differences.
There you go.
If
And
you
that-
don't, just try it, see what happens.
Yeah. So the pelvic floor muscles are muscles like anywhere else in our body. So to say that all you needed to do to fix a muscle is to tighten it is to say, like, I want to get my hands stronger, so I'm going to walk around all day long tensing my fist like this and
Right.
make it stronger. It's like, okay, well, the hand needs to stretch and relax and move all different ways. So does the pelvic floor.
see.
And so a pelvic floor physical therapist can assess how these muscles are moving and working. And are they too tight? Are they too loose? Are they not coordinating with other things? Are there knots or trigger points or scar tissue that's painful and limiting the function?
Yeah,
So
because that can happen after episiotomy,
Yep,
right? Or
yep.
even from like the tearing after having a baby, that can happen.
Yes. So a lot of women that I see postpartum who are dealing with pain with sex, their pain is often related to scar tissue that's not moving as well as it should be from either an episiotomy or the tearing from the birth itself. And they get their 6-week checkup, and the doctor is like, okay, everything looks good, scar's healing well. And they don't really like try and move it around much.
They try
And-
to just not touch it.
Yeah, they're like, oh,
Like,
you know,
don't
hands
touch
off.
Should be
it.
good.
And
Yeah.
so then these women go home with the green light to have sex, and when they finally feel comfortable enough and brave enough to do it, it hurts.
Yeah.
Yeah.
And then if it, some of them end up calling their doctor and saying, hey, I tried and it hurts. And most of my patients that I've talked to, they get told, well, you just had a baby a little while ago. It's going to hurt. Just drink some wine.
I
Maybe
know.
use some more lube.
More
It'll be
wine.
okay.
Little
More
more
wine and
foreplay.
lube just makes everything better.
Yeah, wine makes everything better. Got
And
it.
so
in some situations, yes,
Yeah.
not always, though.
And so
times.
unfortunately, a lot of these women, so then, they maybe try that and it and it hurts again. and they don't think to call their doctor again because they're like, well, last time I called, they just said to drink wine and, use more lube. So they just kind of live with it.
They live with it.
They're like, okay.
But then they want it less,
Yeah.
and they avoid it, and then their husbands feel rejected, and they're like, why don't you want to have sex? And, yada, yada, yada. Here's your job.
Yeah. So I love when I get women who come in who are, I find that most of them have to be very proactive. Either their friend or a coworker, someone has told them about pelvic physical therapy, and they've been brave enough to say, I'm having pain with sex, and someone will say, oh, I know where you need to go. You need to see a pelvic physical therapist, because a lot, and don't get me wrong, there are some OBGYNs who are forward thinking enough that are sending them that way, but a lot of times I get them at like a year or so postpartum because they go back for their yearly exam at that point, and they're like, I'm still having pain. And but they don't.
That's a long time to go.
It's a long time. Yeah.
I wanted to say, I had a C-section, so I didn't even do a vaginal birth, but I actually still had pain after it, too. And I was like, whoa, why is this happening? And I just think that the chemistry changes a little bit, too.
Yeah, there's definitely chemistry changes. And, some women will think, I had a C-section. That
shouldn't be an
scar
issue.
Scar tissue's not going to be a problem for me. Actually, it can be because it can put tension through any of the layers in the abdominal wall,
That's right. There's muscles
around
here.
the organs, that kind of stuff.
Yeah, you had muscle pain up here.
I did. I had so much muscle pain with the pregnancy, but just like she landed on one nerve and just stayed there the entire pregnancy.
Oh yeah, all 9
I was like, ow.
She was just dancing on a nerve.
Nice.
But so I'm just saying, you don't have to have had the vaginal birth to still have pain.
Yes, C-section births can, and just the stress of carrying a baby for 9 months.
Yeah.
Like it's you're carrying a bowling ball on your pelvic floor for an extended period of time, and so your pelvic floor is doing a lot of work. So
It's a
I
lot.
love your eyes. It was like,
bowling ball.
bowling ball on there.
No, thank you.
You're
That's
like,
too much.
Thank you. You just gotta hold it for 9 months, honey.
If I have a big lunch, I'm like, I'm gonna die. But you guys carry people in you.
No, it's kind of a unique experience. They move and stuff. You're like, is that an alien?
Well, mine has a movement too, but it's totally
It's a
different.
different kind of movement, huh?
Oh yeah.
A bowel, perhaps.
Yeah, exactly.
Nice,
You're good,
nice.
you.
I
You
know
and your
things.
science. I'm Angela. Love you.
All right, but there's other. So we should talk about the other reasons. Like, so it's
Yeah,
not
what else?
just after pregnancy, right? Like,
What other
What are the
causes?
other things?
Yeah, so probably the next biggest population I see pain with intercourse with is the postmenopausal women.
Yeah, pretty high.
So that is a really big time where they're getting lots of changes to their whole body, but when menopause happens and we start to lose some of the estrogen in the area, the vaginal tissue and the tissues around there just aren't as supple, and so sex can start to be very painful. It can be very dry. The tissue is just more friable and it's not as plump and supple and giving, and so women can start to experience pain at that point. And even if the muscles weren't the initial cause to the pain, so it might just be that the tissue's really dry, and a lot of people say it feels like sandpaper when they try and have sex.
And some women say they tear a little bit too.
They can tear a little bit, but one of our bodies
sound
Like, ouch, that doesn't sound fun at all. It's not. I hear it's a terrible experience.
You need definitely gallons of lube.
There you go.
That, yeah.
But it can start out as just the pain, and then our body's response to it as a protective mechanism is for the muscles to tense up around it.
Yep.
And then unfortunately, if they don't relax again, then the muscles being tense can be part of the problem too.
Itself.
So it gets into a vicious cycle of pain causing muscle tension, causing pain, causing muscle tension. And
I tell women they're literally traumatizing their vaginas.
yeah.
They are. It's been traumatized. We need to take care of her.
We need to be
it's
very
okay.
nice
But
to
it's
it.
true. You have.
Yeah.
All
So
right.
one of the ways that we work, especially with that population, again, and it goes very much along like we need to stop traumatizing the vagina, is I should have brought them. I didn't. It's vaginal dilators. And so
I don't have
Well,
any
explain
either.
it. What
we
is
can,
it?
Yes.
we
Yeah,
can
explain
get a
that.
few-
What is that?
so vaginal dilators are a way to kind of very gently and in a very controlled fashion, stepwise increase the amount of stretch that the vagina can take, and so they can start out basically the size of a finger bigger or even smaller. I've seen a few really small ones. And they work up, like maybe there's 4 or 5, 6 different sizes, until you're getting up to about erect penis size. And that's so.
I had one client who had to use a dilator up to the width of a phone because she said her husband's penis was that big. She was like, it's this big.
That seems a bit much.
It was. That was the problem. He was just too big and it was painful. So guys, big penises are not always a good thing for females. We're kind of small.
Yes, I have had many a patient say, I wish he was just a pencil size. So I was like, okay, all right.
These situations, a micro penis would be a good thing. Just saying. No, it's true. Go on.
Anyway.
Sorry, I'm just
no,
messing
it's
with
fine.
you.
So the dilators are a way that the woman can herself start to stretch the tissue in a very controlled fashion where she's in control of inserting it, and we're not forcing through pain. We're just very gently increasing the stretch slowly over time until she feels comfortable or has worked up to the size that's closer to her partner. Okay, so that works really well for a lot of women who postmenopausal, sometimes postpartum where we're dealing with scar tissue that needs to be stretched, works well for a lot of women who have been unfortunately thrown into menopause with cancer treatments, breast cancer treatments, stuff like that.
That can cause it early?
So,
That can cause it early if you have
and that's so a lot of women, when they're dealing with breast cancer, depending on the type of breast cancer, they'll shut down ovary function, and that because it's their breast cancer. It's a type of breast cancer that responds to having estrogen around, and so they want to take as much estrogen out, and so they put women into early menopause with it. And so I work a lot with breast cancer patients who are, and other gynecological cancers who are dealing with pain and with intercourse after that. So an unfortunate side effect of a lot of cancer treatments can end up with pain and problems in the pelvic area.
Or erectile dysfunction and the prostate cancer stuff.
Definitely.
Yeah, like I've heard some of the doctors will suggest like a wait and see approach if it's just starting, because a lot of men will get prostate cancer and it's not always best to go in and treat if it's going to affect their quality of life and quality of their sex life. Because for men, they are very closely tied to their penises. I always say this, somewhat jokingly, but literally, like when a man feels like he's not functioning well there, it really like challenges him as a man. And it, it's hard for them. They have a lot of anxiety.
No, definitely.
So, but that's not the only, those aren't the only two. There's other reasons. Or you said, so there's 3, cancer, the menopause, there's post-pregnancy, but there's another category or 2, aren't there?
There are definitely other categories in that. So one that I see fairly frequently is something called vaginismus, and that, which is a condition that can be either idiopathic, which means we really don't know why it started, or it can...
That's a big word for saying I don't know.
Idiopathic sounds more
the medical world wanted to, make it sound better, and then it's like, really, we don't know why.
We have no idea.
We have no idea what's going on. Sorry.
So
try some Tylenol.
I'm going to use that all the time now.
It's just idiopathic.
Totally. That means we know what we're doing.
Nice.
It does make us seem cooler, though, doesn't it?
It does. But
so vaginismus.
Vaginismus is a condition where the pelvic floor muscles are basically kind of spasmed tight, and so they are not allowing any type of penetration into the vaginal canal. So this can be during a gynecological exam. This can be with tampon insertion. So a lot of girls first notice it, that these are people who were never able to insert a tampon, and that it was always painful or not even possible. And then they, maybe get their first boyfriend, or they're virgins and, wait until they're married and they try and have sex and nothing's going in.
I've had a few people who haven't been able to consummate, like, because it's just so painful. And they're married for like 2, 3, 4 years.
Yep.
Can happen.
It can happen. And vaginismus is an interesting one because it can be both. It could be painful or it can be completely not painful. That they just, the door is closed and nothing's getting in. But that's not the most common one. But it's more common that it's painful. There's oftentimes a lot of fear associated with it, is because they've had painful situations, or that it often can be a history of sexual abuse is a common precursor to that. But I have many women who have it, and they hate having a conversation with their new partners, because their new partners, if they're not married and they're, meeting someone new, and that they're like, they all then ask me, well, were you abused? Did you have, and it's like, no, I didn't, like, and they're like, I don't want to have that conversation with someone that I'm, just thinking about
somebody that you're
being
newly
active.
dating.
Yeah. So, but that is
It's kind of a fifth date conversation.
nice, not the first date.
Not your first.
Not your first date.
So I was
Yeah.
abused. There may be some issues with
Yeah.
our dating. No, that's
Yeah.
terrible.
No. Yeah. Like, wait a minute.
First
No,
date.
thank you.
Exactly.
So yeah, that patient population again is another population that usually responds well to the dilators. Dilators often, the majority of it is done at home. It's something that people do on a daily basis, but it's helpful to have someone like a pelvic physical therapist work with you with them. I've had many patients whose doctor has simply handed them a box of dilators and said, "You need to do this. Go do it."
Yeah.
And they're like,
I don't know what to do with
I don't
that,
know what
yeah.
to do with this.
Do
And
I
that-
like hit things with
yeah,
it?
like what do I do? And that's so a pelvic
He's
physical
playing
therapist
drums
does
over
that.
there.
Doo-doo-doo. Yeah, yep. That's exactly what you're supposed to do with them.
Thank you. That was helpful.
Working with a pelvic physical therapist to help you progress them can be good.
Yeah.
So
Well, aren't there there's some sort of deep breathing exercises you have them do, and
you can teach them how to relax while you're doing it, how to, tricks or tips that they can do to help the muscles be a little bit more flexible when they're doing it, how to progress from the different dilators. So sometimes people, they're like, I can do the size 3 one really well, but I can't, seem to progress on to the size 4. So working with a therapist that way can be helpful for it.
So you said you also work with people for sexual dysfunction. How does the pelvic floor come into that?
Yeah.
How can pelvic floor muscle problems cause sexual dysfunction?
Yes, they definitely can. So our pelvic floor muscles are, they have many functions.
What are the muscles we're talking about? Like, are there names?
So here are our pelvic floor muscles.
Those ones right there.
Yeah, so there's a superficial layer,
there.
and then that's the deep layer. They basically make a bowl on the bottom
Okay.
of our pelvis,
I see.
and they go around.
So it's soup
Kind of
bowl
like
you're sitting in.
Louisiana.
Yeah.
Right? New Orleans?
Right. So this is New
Well,
Orleans. So this is
This
New
is your
Orleans.
New Orleans.
Where's our French Quarter?
The French
Nice.
Quarter's the clitoris.
Nice. All right.
Yeah.
You didn't mean to move it in any ways
Yeah,
so people
yeah.
can see. She was thrown off by New Orleans.
I was thrown off.
Like,
by
I
the
don't
New
know what
Orleans
to go
reference,
with
but I'm
this.
like, all right, well,
Hey,
let's
you
run with
brought
that.
soup bowls.
Yeah.
You
into
brought
it.
a soup bowl. We just went to the logical next step.
Yes,
I mean,
that-
really.
Clearly.
definitely.
Totally logical.
Yeah.
All right. So, continue.
No, but so these muscles, they have many functions. So one, because they attach around the bottom of this whole pelvis, they are a support structure for this bony ring here. Okay, so they support from the bottom, the abdominal muscles support from the front, the buttocks muscles support from the back. So they help to keep the pelvis together.
Yeah,
Okay,
keep you together.
Keep you together.
Keep it together.
They make that bowl on the bottom of the
Yeah.
pelvis, so
Okay,
they
here's
help
the bowl.
to support the pelvic organs. So our bladder in females, our bladder, our uterus, and our rectum are all
I feel
sitting
like
in
Vanna
there.
White doing this. You
Yeah,
want to play
you're
with
doing
me?
it
Vanna?
weird. I don't know what you're doing.
You're like-
You're like,
No, I'm showing. I'm showing. She said the bowl, so I and then she said the pelvis, or the butt. So I turned it around so you could see the butt side.
There you
like
go.
I'm really clearly getting this.
yeah, you're very Vanna White.
Nice.
with
I
it.
know. I was
Nice.
thinking, I'm like, I feel like Vanna White with a pelvis. This is great. She had a great job.
Nice.
Continue.
All right. So so they support the pelvic organs. They also basically they're involved in peeing and pooping, and
Yeah.
that's so they close the holes when things aren't supposed to come out, and they open the holes when things are supposed to come out. Okay, and then they're involved in sexual function. So these muscles are involved in the act of us getting aroused. They're involved in the orgasm process, and that's so. If I go back to the hand analogy where I'm just clenching or holding the hand tight all the time, I'm never going to let good blood flow through here. So, and that's one of the main things that needs to happen when we're getting aroused and, going to have an orgasm. We need a nice healthy blood flow to this area, let everything kind of fill up. And that, so if the muscles are holding in a clenched position all the time, which a lot of women clench their pelvic floor and have no idea that they're clenching it all the time. It's a common place that we hold tension. And so teaching the women to kind of relax and let go through
I
that
say
area.
men hold their stress in their penis, so maybe
Yeah.
women hold their stress in
Yeah.
their
There
vagina.
You
you
just
go.
need a good massage.
Deep tissue.
Deep
Yeah.
tissue. Oh yeah.
Nice. So
You medical stuff. Continue.
Yeah, no,
We're just
it's
going to
all right.
poke fun at it. You know,
Yeah,
give
it
it
works.
interesting.
So, sexual dysfunction can happen if the muscles are too tense, too tight, not relaxing and moving the way that they need be. The muscles themselves can be causing pain in the area, and therefore we're having trouble with libido getting aroused and feeling like you even want to.
Right, yeah.
And that,
Oh, yeah, if you have pain, you're not going to be in the mood.
and
Yeah.
often,
Unless you like pain, but this isn't
yeah.
That's
consensual.
not the
Not-
same
not-
kind of pain.
yeah,
Guys,
not-
it's different. You're not consenting to that
Yeah.
pain. If you're consenting, it's
Yeah.
very sexy.
What if you didn't consent to it? No.
I don't know.
it's
No,
still
you
no.
can't because it's like your body's attacking you. You feel out of control, and
Oh, I
women
know.
hate it. They tell me they feel kind of like this sense of brokenness, and the very thing that kind of
yeah.
identifies them as being female too.
I think sexuality is a big part of every adult.
It's
Yeah.
a tough topic.
yeah. And one that
Nobody wants to be broken.
Well, no,
No, nobody
definitely
wants to
not.
feel that way.
Yeah. And along that lines, I get a lot of women who potentially are avoiding sex, not because they're having pain or that in this area, but because they're worried they're going to pee during sex or have an accident because they're having bladder control issues and their pelvic floor muscles can be part of that they're not controlling well. So they avoid because they're embarrassed.
They don't want to be embarrassed. Yeah.
Yeah, they don't want to be
Yeah.
embarrassed in the situation. So again, that can cause problems. So,
Yeah.
so there's definitely multiple ways that.
And the anxiety of it, I'm sure that makes it even worse.
Yeah.
Harder to get into it.
Yeah, definitely.
You know, you mentioned a treatment team. Who's on this treatment team?
Yeah, no. So it really depends on the person, but I feel like, especially if we're talking about specifically with pain with sex, and that a pelvic physical therapist, a sex therapist, yes,
Like
Can
an
be.
Angela.
Like
An
a me,
Angela.
but I do a very different thing. I will not go into your vagina.
No,
We'll talk all about it and talk about your relationship.
sure.
we should actually probably talk about that. That I probably will go into your vagina.
Yeah.
Yep.
So we'll come
you
back
will
to
have-
that. Yeah.
gloves.
You will have
Yeah.
them.
Gloves.
Yes.
No, but so that is
That's
an
a big
important
difference.
distinction. So like as a sex therapist, it's all talk therapy.
Right.
But what I'm doing when it comes to pain is that a lot of couples have stopped having sex for like a long period of time, and so now they're going to physical therapy. But okay, it's great to get the muscle structure in order, but if you haven't been intimate with your partner for a really long time, there's all these things like who's going to initiate, how should we initiate? Should I wait for her? Should she be doing it? And then also they'll have stopped everything, like certain forms of affection, because what happens to the woman is she's afraid she is leading him on and she doesn't want to follow through with sex. And so, even with basic affection, so she'll avoid things like kissing or just basic
No touching.
Yeah, no
Yeah,
touching,
because she
hands
doesn't
off.
want to lead him on, but then they're missing out on like some very basic
Yeah.
Human
connections,
interaction.
human touch.
Yeah.
Yeah. And so a lot of what I
kind of
do
important.
is the couple interaction stuff. I always take a lead from you physical therapists. So if the physical therapist says no penis and vagina intercourse until you're at a certain point, then I teach them ways to be intimate and sexual without that. Because by the way, that's not the only way to be sexual. Just want to
Yes.
throw that out there. Your
Yes.
whole body can be a sexual organ. But then the other piece that I do is more anxiety. I have women who are working with you or another physical therapist, and they're like, I feel like I can do it by myself, but when it comes to
Yeah.
sex, I'm freaked out. I don't think it's going to work. And so
Yeah.
we do kind of a version of mindfulness to teach them to take it one moment at a time, be fully present, stimulate your nerve endings, focus on what's pleasurable. But it's its own process to get people past the anxiety.
No, that's so important because I've had many women who are progressing really well with the physical side that we're
Yeah.
working on, and
They've
they're
been
doing great. They're
dilating
like,
up the
"Woo,
wazoo.
I've got
No,
this."
Literally.
Not the wazoo, the vaginal.
Oh, yeah. The vajayjay.
The JJ, that's what it is.
Yeah, but the thought of bringing their partner back
Yeah.
into it and all that is
some fear in
there's
there,
some
yeah.
fear associated with it. So making that transition over and that that's where definitely working with a sex therapist can be really important.
But then that's where the line stops because I don't go into a vagina and you do.
So if you're in sex therapy and your pants are off, you're doing it wrong. But
people ask if they're supposed to get
Right.
naked, and I'm like, absolutely
no,
not.
absolutely
Please
not.
don't get
You're doing
naked
it-
in my
you're
office.
doing it wrong. But if they go see a pelvic floor physical therapist, they
You're
may
doing it
get
right.
undressed as a part of it.
So yes, just
Face down, though. Yeah.
throwing it out there like that's not what
Nobody
we-
said that, Angela. What are you talking about? Nobody said they had to be face down. What are you talking about?
No, I meant waist down. I said the whole. I totally said the wrong word, but it's funny. I
Sure.
thank you for clarifying because
Wait.
then everyone's gonna be like, why are they going from behind?
Also, they could take their top off. You never know.
No, usually they have their shirt.
sure.
It's like what you get like a drape
Little
on your
gown or
legs or
something.
something.
Yes.
So let her go.
Yeah.
Tell us more about what
I
you
think
do.
She got this.
We're just making guesses
Yeah,
here.
no, you're fine. So I look at the person, different pelvic physical therapist. I'll do it a little bit differently, but one, for comfort's sake, and two, because I believe that all of our muscles in our body work together. And that's so I start out my evaluation looking at the muscles around the pelvic area. So abdominal, back, hip, buttocks, thigh muscles. And that's just done by talking with the person and having them move through some different positions and seeing how strong, flexible, and coordinated they are.
Yeah.
Letting them know, okay, do any of these cause any pain? Do you feel any tension? Does this cause pressure anywhere? Like, they're just letting me know what they feel. And then the second part is looking more specifically at the pelvic floor muscles themselves. And the gold standard for that is similar to a gynecological evaluation in females.
Yeah.
And so it involves them getting undressed from the waist down. At my office, I do not have stirrups. It's not like a gynecologist chair. It's, trying to be as comfortable as possible and kind of supporting their legs. But I'd insert one gloved finger into the vaginal canal. And I'm assessing where the muscles are resting. Are they too tight? Are they too loose? Is there scar tissue? Kind of getting a whole big picture of how they're moving and that. And that part typically takes maybe like 5 minutes or so. It's not, we're not in there for a long time.
Yeah, you're not there for an hour.
Yeah, no, and it's very much just trying to get an assessment of what's going on. And then depending on what we find, internal treatments might be involved in future sessions. And that if we have a lot of scar tissue or knots or trigger points that we need to use manual techniques to work out, then we'll do that. But we talk through that ahead of time and we plan for
They know
it.
what's going to happen.
Yeah, they know what's
You don't
going to happen.
surprise
She's
them.
got a good bedside manner, is what she is saying.
Yes.
You know? Like, I'll make you feel comfortable.
You ease them into it.
Take your coat off for you. You know, I'm just kidding.
Yeah.
Well, I feel like in general, because females are used to going to the gynecologist,
Yeah.
they're a little bit more used to that. When I work with my male clients, I find that oftentimes their referring physician hasn't maybe prepped them for the fact that what the examination might entail.
I see.
And so I get
Like,
a
why
lot
am I
of
squatting?
I get a lot of gentlemen clients, patients who come in, and I explain ahead of time what we're going to do. And so in guys, the gold standard is a single-digit insertion into the anus to assess the pelvic floor muscles. And so many of them, their eyes kind of light up a little bit when they hear that, and they're like, I didn't expect
At least buy
that.
me a drink first.
Yeah. So I find that usually with my male clients,
Once you're in your 40s and 50s, they just start going up there all the
yeah.
time. Like, they do it all the time.
Yeah, you gotta
But
check
as
your butt.
a
Gotta check
younger
your
guy,
butt.
like, they never really.
Yeah.
I've never taken my clothes off for my doctor. It never really happens.
It's a rare thing. They don't even cup your balls. I heard that was a thing.
I've had it done once in the last 10 years.
Really?
It was
Interesting.
wonderful, but
Was it good for you?
yeah.
No.
No. Yeah.
Oh, you're.
But I think women are used to it more.
A little bit more.
Because you have the annual gynecological PAP, so women all are
But
used to that process.
Ultimately, it's being respectful of the patient. I've had some women that they're so fearful or it's been so painful that they're like they refuse, or they're like, well, we can look at the area, but like no
They're
touch
too worried
yet
about
and
it.
that. And so I've had some women that we work on just like, I'm going to gently touch your thigh,
Right.
and getting them used to just touch moving towards that area, that area has been off limits for so long that there's no way that the first time she and I are meeting that I'm going anywhere near that.
So if they're a little scared, they just need to let you know.
Yeah,
so
it's
you
not
can
anything
work
like,
with
oh, you
them.
have
Totally
to do this,
normal.
otherwise we won't. No, I
you
was
don't
like,
have to
the
do
fact
anything.
That, yeah,
You're
the
an
fact,
adult. You can walk out.
Yeah,
You
the
can
fact that we're not doing it gives me information as to where we start, like how we move
So it's
forward.
part of the
from here.
assessment.
Yeah,
Huh.
No,
I don't
so-
know. And you were mentioning a third part of the treatment team that I don't think we've really delved into, which
Urologist?
is the medical doctors.
Yep, medical doctor. And
Medical
so
Mm-hmm.
when we're talking about pelvic pain, it can be a challenge sometimes to find someone on the medical doctor side of it who can really take ownership and help. So it potentially is going to be a urologist. It could be a urogynecologist, which is basically a physician who's board certified in urology and gynecology. So they only specialize in kind of the female organs and bladder issue type stuff. It might be an OBGYN. It might be a gynecologist. Might be. There's a few in St. Louis, a few physical medicine and rehabilitation doctors who work more on the musculoskeletal side of things, but specialize in pelvic area. So what my recommendation to people who are going through this is, if you don't like what your doctor says about it, if they just give you the like go drink some more wine or just use a lot of lube, find another doctor.
Yeah.
Like that, it's not, don't let them shame you into thinking that this is all in your head and this is something that you're just going to have to live with. Like there are other doctors out there. Unfortunately, a lot of times it does take some searching to find a good one, or at least one that's very compassionate about it. There's several doctors in town who are wonderful, maybe don't necessarily have all the answers for why you're dealing with pelvic pain, but they're at least extremely compassionate and listening to
They're
you and are
receptive.
and willing to work with you.
And willing to offer you the suggestions. The hard
Yeah.
thing is not all the doctors will offer a referral to pelvic floor, either because they don't know about it, or like you said, they kind of don't have maybe a respect for it. Like, what, you're just doing Kegels, why do I have to?
Yeah.
And it's a lot more than Kegels.
Yeah.
Especially
Like,
on the
physical
pelvic pain
therapists
side
exist
of
for a
it.
reason.
Yeah.
Like,
Yeah.
like if your doctor could just give you a piece of paper and say, go do this, then there wouldn't be physical therapists.
Yes.
Reality
Yeah.
is,
Yeah.
yeah, it's a lot of work. Yeah.
Yeah, you're in physical therapy now.
I am now,
Not for
yeah.
the same reason, because he had a back surgery, so it's more back stuff.
Fun
But
stuff.
like they do all that same stuff. They did
Yeah.
the assessment, put them in weird positions.
Oh, I
now
hate
they're
it
making
so
them do
much.
exercises.
It's so painful.
It is the first one. That's
I go
important
again
for people
tomorrow.
to know it may be painful in the assessment too, because like,
No, the
you're
whole
testing.
process.
Oh,
The whole
poor
process.
thing.
For me, I had a spinal surgery though,
Yeah.
so yeah.
Yeah. So
But the goal of that therapy, pelvic floor, is to reduce the pain, and in
Correct.
therapy a lot of times.
So a lot of times, unfortunately, I have had some patients who potentially have done therapy before, and they said how painful it was for the pelvic area, and that.
Yeah.
And, there are some therapists that kind of have that theory that of no pain, no gain.
Well, that's a terrible point of view to
Yeah,
have.
I do not,
No.
and a lot of us don't, especially when it comes to this, because if you're having a pain response, you're just going to keep feeding that cycle of everything thinking like anything coming towards here is going to be painful.
Yeah.
And so we really work
'Cause
towards.
then the muscles will just react
That's it.
more.
We can't
and-
keep traumatizing the area.
Yeah,
Eventually,
yeah,
it's like doors closed for service.
Yeah.
Not happening ever again.
Yeah.
That's
Yeah.
what my spine said. You're out. It's kicking me
Like,
out of
screw
there.
you. We are not walking or moving or anything. No, he's actually been doing a great job.
Yeah. I started swimming
Well,
He
good.
started swimming.
again.
Nice, nice.
Fun stuff.
Yeah, so that's really important. And, like on the sex therapy side of that, one of the things I've been working on with all of my clients is reassociating positive feelings with sex, because basically all of it has become shut down because it's like, well, this was painful. And then like all the other stuff like started to become maybe not painful, but like it became neutral or negative to
Or
them. Like they
reactive
could,
to-
because
to
they
the
knew that this
pain.
might lead to this, might lead to this. And so, we take sex off the table for a time, and like sometimes there's just dry humping involved and a lot of making out. No, it's seriously.
Oh, that can be a good thing.
No, it can
I
be
didn't-
fun, but like
I have no problem with
it's
dry
meant-
humping. So,
It's really meant to remind them that the sex can be pleasurable again, and there are a
Yeah.
variety of ways to do it.
you take the pain
And
out
that-
for a
yeah,
bit.
take the pain out for a bit until you guys do some of your work and get that, get those muscles moving the right way. And then by the time that they're getting there, they're actually experiencing desire again for
Yeah.
sex.
That's good.
So there's a lot of good stuff to do.
I think it's an important part of sex.
Yeah.
Desire.
Are there any
Yeah.
things that doctors, since you were talking about doctors, are there any things that doctors like do to accompany you as far as like treatment?
Yeah, there are definitely some treatment options that are out there. So there are some medicine options that can help, especially if the muscles are, dealing with some muscle tension or dealing with some nerve pain in the issue. So there's some
yeah.
medicines that can specifically help with nerve symptoms to kind of calm things down. There's some topical medicines that can be put on the area, especially if the pain is more right around the vestibule or the vulvar area. That like a
What's a vestibule?
The vestibule is the area right around the opening of the vagina here.
Oh,
So the
okay.
vulva is the whole area encompassing. I'm showing myself, and they don't get to see.
Show
I'm like,
them.
hi, let's look at it. And the vestibule is right around the opening of the vagina.
Closer. Watch, you go for
Oh,
it. good.
There's vestibule.
Good.
You're good. People can see it.
And then the vulva encompasses more of the area there. But topical lidocaine is something that they might recommend to help kind of give some temporary pain relief in the area. There's sometimes some women potentially go through Botox injections for their pelvic
I've heard
floor.
of that.
Does that help?
It can in the right situation, that if the muscles are just spasm tight and just not letting go, they can get them to let go. Risk factors associated with that are these
I thought
muscles.
they tried to avoid like paralyzing muscles with that.
They
I guess.
do, but Botox can be helpful in the right situations. It's used for many different muscular conditions, but there are risks associated with it. So these guys help to make sure that we don't pee and poop on ourselves. And so if we hit the area too much,
you don't want to do that.
Then we potentially have issues on that end of the spectrum.
Issues,
And there are also certain surgeries some people might get it, but we always try to go like low risk before we go high risk. Surgeries are higher risk, and so it's always better to do the easiest route first. Not that this is like easy. There's some work involved in this,
risk.
but like lower risk. Anytime you go in
damage.
cutting, you have risk of more scar tissue and the body not working as well. So we try to do that as a last resort, but doctors are available to do certain surgeries.
Definitely. Along the lines with working with your physician and a pelvic physical therapist, and that you, as the person who's dealing with these symptoms, might be the one to have to bring up the idea of pelvic physical therapy to your doctor. That they might not be familiar with it, and so you might have to be the proactive one. So don't necessarily assume, well, my doctor hasn't told me about pelvic physical therapy, so he or she must not think I need it. And that they might not have it on their radar at all. And so you might need to be the one to kind of search
Lead
that
them
out.
That way.
Well, there's a reason for that. I actually was talking to a doctor recently, and one of the things she said for why that can be the case is that doctors are really kind of doing a triage. So they're thinking about life and death first, not quality of life.
Right.
And there are some more forward-thinking doctors who are like, well, quality of life, quality of sex, but like cancer, is there anything that could potentially cause your bladder to not work at all? Things like that.
Right.
So it's just kind
Those
of
are more important.
and they only have 10 to 15 minutes to spend with you, so they're not. They may not advocate for some of the things that you need, like physical therapy, because they're thinking more along those other lines, like, is this an abnormal pap? What happened here? That sort of thing. Okay.
So just know that as a patient, you might have to be the one advocating for it. That's okay.
Yep. And doctors love it when you go on WebMD and
they're like, I have these
they're
symptoms.
big fans of that. They're like, let me tell you, you have cancer. Is that what you found on WebMD? Yeah, I have cancer. That's it. Yep.
It's endometriosis.
Every single thing you look up on WebMD will list cancer as one of the possible causes. Every single thing. So apparently everything I have causes cancer. Exactly.
So that's what we need to find, and then you'll be okay, cured.
Sounds good. You have any other questions, Adrian?
I was thinking of two other issues that we could maybe briefly discuss, because actually endometriosis did just come into my mind, and the other one was
It's 10 a.m. So
okay. Just so we know, we're at an hour. And then the other one is actually chronic orgasming. I can't remember the name of it.
Oh,
but
what is
where
that?
they're being either constantly horny
constantly
and constantly
getting orgasms?
orgasming, but not having any release. I'm struggling with the name, so I'm curious if you do any work with those two.
And that one?
PGAD, yes, PGAD.
EGAD.
PGAD. No, PGAD.
So with that one, people initially when they hear
Persistent
that
genital arousal disorder. That's what it is.
That sounds like it can be a problem.
Yes.
So it is.
People up front, when they hear it, like, oh, isn't that a good thing? It's like, no. Think about going through your day aroused all day long and potentially orgasming.
Yeah, you're in a meeting.
Yeah.
I was a teenage boy. I know what you're talking about.
Exactly what that's like.
100%.
That's why they stay in their desks for a while after it ends. Like, I'm just studying.
You're like, I'm really studying algebra really intensely.
No, we had an erection.
How dare you?
So PGAD is something you work with.
So it's not a common condition, but it is out there, and that's definitely something that pelvic physical therapy can help out with. Again, we'd be assessing what's going on with the pelvic muscles there. Are they not releasing or letting go the way they should be? Is there faulty muscle tension or movement around there that's, kind of feeding into the nerves that are supplying the area for arousal and orgasm and that. And so what can we change that way? Can we learn to teach the person some techniques to kind of relax and down train everything in the area? So it's definitely something that pelvic physical therapy can help with and work with it that way. And then you asked about endometriosis.
What's endometriosis?
Endometriosis is.
I'm just gonna do. I was thinking of these like
It's
tumors
juggling.
and stuff. There's
Oh.
like cysts and
So,
things.
Okay.
yeah,
I mean,
that's close.
I'm not a doctor,
No,
so.
you're fine.
So let's let her answer then.
I know, right? This is a great explanation
So,
for endometriosis.
It's where your hands randomly go like this
There's
during a
things making
podcast.
circular motions in. No, go on.
No, so endometriosis, we have the endometrial lining inside our uterus. We shed that every month during
Right.
our menstrual cycle.
Sure.
And that endometriosis is where some of that endometrial tissue somehow finds its way outside of the uterus and is in the abdominal cavity. It actually, they've done...
Like mixed in with your organs?
Yep, it
Oh.
ends up like kind of landing on
Floating
like
elsewhere?
floating elsewhere.
Where it's not supposed to be.
Where it's not supposed
and
to
it
be.
creates a lot of pain.
A lot of pain, a lot of scar
issues.
tissue, a lot of
Sometimes people
adhesions.
struggle to have babies as a result.
Yeah, potentially infertility issues. So it is the gold standard for diagnosing it, unfortunately, is a laparoscopic surgery to basically go in there and look and say, yes, there's endometrial tissue there.
Yeah.
And then they try and clean it out. And that, so a lot of women, they can start having issues with this in their early teens and live with it for a long, long time.
That's rough.
But yeah, so it can affect sexual dysfunction and cause pelvic pain, have bowel and bladder issues, all of that because the endometrial tissue is adhering and causing kind of scarring down of different areas. And again, working with a pelvic physical therapist to try and create optimal movement of everything in the area and optimal functioning can help to minimize the pain and help the women, feel more comfortable in that. So
Okay.
it's definitely
That's great.
something that can be beneficial.
That's a rough.
Yeah.
That has to be a rough
There's a
thing.
lot
That's
of
a
rough
rough
stuff
one.
she works with. But I
In
think,
general, there's
Yeah.
a lot of rough things that can happen to your body.
Yeah,
Yeah.
definitely.
well, I think we've covered all we want to ask.
I
Is
think
there
so.
any like final things that are important, like, that our viewers should know, or do you think we've covered it?
No, I think you guys have done a great job, covering a lot of the topics related to painful intercourse. And that what I'd say for, people who are potentially dealing with it, you are not alone. Like there are definitely other women and men who are dealing with it. And that so it's unfortunately not something that is as commonly talked about. And so people feel very isolated when they're going through it. But there is help out there, talk to your doctor about it, see about going to pelvic physical therapy. And yeah, there are options to help. So please don't try and live with it and just think it's normal because you had a
Right.
baby, or
Don't
it's
push
normal because I'm menopausal. No, it's not.
So, quick question. So, is it normal to have some pain after you have a pregnancy during sex? Or is it just if you have any pain after that 6 weeks and you go back in, is it a problem?
The first time might not be your most comfortable time and that afterwards because everything,
Sure.
It got moved around and there could be some scar tissue in that. But, as long as it's getting progressively better, like, okay, that wasn't my best time, but it's getting
But it's not
better.
getting worse or
yeah, it
staying
shouldn't
the
stay
same.
the same. It shouldn't be getting worse and
Okay.
that. So,
Good to
yeah.
know.
Yeah.
Okay. Well, thank you for coming.
You're
it was really
welcome.
great to have you.
No,
And
happy to.
people can find you at legacytherapystl.com.
Correct.
Or they can find you at legacytherapystl.com/blog, where you have a blog.
Yep.
And they can find you on Facebook at Legacy Physical Therapy STL. And Angela, who are you? Where can they find you?
Oh, well, of course, if you need sex therapy or marriage therapy, because I do both, right?
Yeah.
Or
does
couples.
it.
You
She
know, you
does
don't
it
have to be
all.
married. I do it all,
She
right?
does it all.
www.therapistintlouis.com. I also have a Facebook page. Just look up St. Louis Marriage Therapy, where I post all of these podcasts and, just everything we do.
Yep. And you can find us at aboutsexpodcast.com. And please go on to iTunes, leave us a review. And thank you for being here.
Cool.
Have a
Thanks
good
for
day.
having me, guys.
Bye. Done and bye.
Bye.